Hello, I'm Dr. Barry Singer, and I'm a neurologist specializing in the diagnosis, treatment, and management of people living with multiple sclerosis. And I'm delighted to be joined by Aaryn and Charlotte, two inspiring members of Biogen's MS community, and they're going to be able to share their MS journey and experiences, including treatment with VUMERITY. MS is an autoimmune disease where the immune system attacks the brain, spinal cord, and nerves. This leads to disruption of signals that can lead to neurologic symptoms, including numbness and weakness. And it is important to know that with relapses, there's periods of remission where the disease can improve, where attacks can get better. But unfortunately, some people are left with disability after these attacks. And so it's important to keep in mind that MS affects everyone very differently, depending on where in the nervous system it hits and how aggressive the disease is. And a lot of symptoms can be invisible. So there can be symptoms that you can't necessarily see when someone walks down the street. So everyone is different with this story, and so I'm very excited to hear the stories of Aaryn and Charlotte and how they learned to navigate this disease. So Aaryn and Charlotte, great to have you here. To begin our conversation, I really want to focus on your initial symptoms of MS. Were there any symptoms looking back that were missed? And what prompted you to go see your neurologist?
Well, thank you, Dr. Singer and Charlotte. It's nice to be here with both of you. For me, it started with chronic migraines, and the severity and frequency of those were such that it was very much interfering with my job, and that's when I sought treatment to go to a neurologist. And based on the neurological testing, which included, putting my head forward and back and having a kind of a shock to my spine, which honestly, I didn't know that was a symptom of MS, led my physician to order an MRI. And from there, that's when I was diagnosed.
Yeah, Aaryn, we call it Lhermitte's sign when you do that, and it's a sign of cervical spinal cord demyelination. And Charlotte, what about your story? What was your experience?
For me, it was more immediate, so not a gradual progression. It was completely unexpected. I woke up one morning with double vision. I immediately contacted my eye doctor, and he advised I get an appointment with the neurologist. In the time leading up to that first appointment, I began experiencing nausea and had trouble walking, but I was still carrying on my everyday routine with impaired vision. Sometimes my symptoms would get better, but eventually it would come back again. At the appointment with the neurologist, they found a single brain lesion, and it did not lead immediately to my diagnosis with multiple sclerosis at that time. So my neurologist planned to monitor the lesion over time.
So can you tell us a little bit about your experience once you finally did get diagnosed with MS? How did you get the diagnosis and what was your reaction?
Well, I held on to the hope that I did not have MS until I had a 2-week migraine, and it led to me going back to my neurologist. And I did a follow-up MRI, which revealed I had more and further developed brain lesions, which prompted to my MS diagnosis, which was nearly 7 years later from those initial symptoms. I was panicked. I was nervous, scared, frightened. I remembered sitting in the neurologist's office with my husband, and we began talking about I needed to start treatment that day. I felt like an out-of-body experience. MS was not familiar to me. I felt overwhelmed.
Wow, that's pretty terrifying. What about you, Aaryn? How was it like for you getting diagnosed, and what was your reaction?
Yeah, So an MRI led to the diagnosis of clinically isolated syndrome initially, but it wasn't until years later, from those initial symptoms that I described earlier, that I began experiencing extreme fatigue, chronic fatigue, and then burning sensation and pain in both of my eyes, which led to another MRI. And at that point, I was diagnosed with relapsing-remitting MS. And I would say that initially, with the clinically isolated syndrome diagnosis, I think I was okay with that. But then, as it progressed into relapsing-remitting, I was devastated. I just remember being extremely sad. I had a 2-year-old son. I was looking to expand my family. I had just started a new job. And so trying to envision a life now managing MS, it really was not on my radar. And so initially I leaned on a friend of mine whose husband had MS, and she herself is a physician. So she was a very good source of support for me. And I think because of the progression from the clinically isolated to relapsing remitting, motivated me to begin treatment.
If someone's out there and they're listening to this, watching this video, what would your advice be to them? Someone that just got diagnosed with MS, or someone trying to go through this, navigate this whole healthcare system to get a diagnosis and get on treatment?
Yeah, I would say it was, as I mentioned, it was such a shock and a surprise initially that it was very difficult to process. So taking the time that you need to really process the diagnosis is very important. And as I mentioned as well, I had a friend who served as a resource. I would also say that your healthcare team is very important to be open with, to ensure you have the right fit as a partner for your neurologist, that they're listening to you. A good open relationship is extremely valuable and important.
Yeah, that's really solid advice. And what about Charlotte? What's your advice for those newly diagnosed with MS that are going through this whole process?
Aaryn makes some very good points. I would say ask questions. I didn't know what to ask, if I'm honest, but I would say find out what relapse and remitting really means, what your treatment options are, know how much time you might need in order to make a decision, and what your treatment goals should be. Be empowered to advocate for yourself when you're having those conversations with your treatment team, and take the time to ask your doctor all the questions you might have to ensure you make the right treatment decision for you.
So, Charlotte and Aaryn, I know you both had been on other disease-modifying therapies before switching to VUMERITY. So how did you work with your neurologist in partnership to determine that you were going to go to VUMERITY? And was there specific things that helped you make that decision to choose VUMERITY or diroximel fumarate?
Well, for me, I can say that with my busy schedule with work, my children, community activities, it was important to find something I could take on the go. And the oral medication was very important. I spoke with my doctor. I wanted to understand more about VUMERITY and its benefit and how it fit with my treatment goals. And more importantly, how it can best fit to make it easier for me to take the medication. I wanted to make sure I was adhering to the plan. And so VUMERITY fit in with that goal.
So thanks for sharing that, Charlotte. What about you, Aaryn? How did VUMERITY come into play for you?
I knew I was interested in an oral option to manage my MS, and being able to take VUMERITY either at home or on the go was very appealing to me. In conjunction with my neurologist, we discussed several options and the possible benefits and risks associated with different therapies, and decided that VUMERITY, given its safety profile, was a very good choice.
All right, great. Well, thanks for sharing why you selected VUMERITY, also known as Diroximel fumarate. In addition to your healthcare team, there are certain resources that help people out living with MS. And so whether it be advocacy group information or support systems, what really has inspired you and helped you along this journey with this diagnosis besides your healthcare team?
Yeah, besides my healthcare team, and I would also say, my family has been a wonderful source of support. Recognizing that MS is part of my identity, and really having paired that with what I enjoy the most is really empowering people, other people, and team building. As I had previously served as a manager, I've learned through my own MS experience and coupling that with those activities that I can very much help support those who are trying to navigate transitional changes such as my own with MS. So serving as a health coach and supporting others, primarily women, with their own diagnoses has really served as a good option for me. And not only do I feel like I'm serving as a resource, but I feel they're a resource for me because we all learn from each other.
Yeah, that's amazing, Aaryn. So really taking something that was kind of at first a negative and a shock to you, turning into something positive that can help others. That's amazing. And what about you, Charlotte?
Well said, Aaryn. I have to say my family is a big support as well. I'm glad to know there are people out there like Aaryn, because I could have used that health coach to help me along the way because it was so scary in the beginning. But I will say that my healthcare provider is always my first call for any medical advice. And the nurse educators who work on behalf of Biogen were instrumental in helping me manage my VUMERITY treatment. For the nurse educators, I love them. They would regularly check in with me to discuss my symptoms. We would talk about my test results and make sure I was sticking with my VUMERITY dosing schedule. They were also available to answer any questions that I had about taking my VUMERITY. So that was instrumental in helping me to get to where I am today.
So Charlotte, when you think about using VUMERITY or diroximel fumarate into your daily routine, how does that fit in? We know it's twice a day, so how does that work with your daily routine?
Well, I told you, Dr. Singer, I stay busy. So between busy with work and busy with my kids, and also with community activities with my sorority, I love the VUMERITY mobile app. I can log in and record how I'm feeling, what symptoms I'm having at that time, and it helps me to manage my treatment reminders. It also allows me to have a record at the touch of a fingertip that when I'm talking to my healthcare provider team, I can actually tell them very comprehensive and accurate information over time for what symptoms I've experienced and how I've been feeling over extended period. It enables me to listen to my body better and take it easy when I need to. And I try to take things one day at a time. I do well sometimes, other times not so well.
And what about you, Aaryn? How do you stick with the treatment? We call it adherence. People taking their medication regularly do very well, in my experience, over treating MS for 3 decades. So, Aaryn, how do you stick with the plan? with your VUMERITY?
Yeah, and Charlotte, I love that you use the mobile app. I think that's a great idea. For me, I really just integrate it to my daily routine since VUMERITY is taken twice a day. I take it morning and night, and that seems to work very well.
There we go. So I really want to thank you both for, sharing your insights. I think, sharing your story, your journey of getting diagnosed with MS, as well as some of those obstacles that you hit trying to get diagnosed. It took you both a while to finally getting to that official diagnosis. And we see that with lots of people. But also how you turn something that, is kind of a negative. You get this diagnosis into something positive, and you've moved forward. And are now advocating for other people living with MS. So thank you very much for sharing your stories with MS as well as your VUMERITY stories. And so hopefully this has been inspiring for others living out there. And again, really the important parameters that we look at are goal setting, that selection of the appropriate medication that fits for you, and adherence, really sticking with the plan. And these are the central 3 pillars to MS management. So thanks for joining us.
Important safety information. Do not take VUMERITY if you have had an allergic reaction, such as welts, hives, swelling of the face, lips, mouth, or tongue, or difficulty breathing to Diroximel fumarate, dimethyl fumarate, or any of the ingredients in VUMERITY. Are taking dimethyl fumarate. Before taking and while you take VUMERITY, tell your healthcare provider about all of your medical conditions, including if you have liver problems, have kidney problems, have or have had low white blood cell counts or an infection, are pregnant or plan to become pregnant. It is not known if VUMERITY will harm your unborn baby. If you become pregnant while taking VUMERITY, talk to your healthcare provider about enrolling in the Blossoms Pregnancy Registry. You can enroll in this registry by calling 1-833-569-2635 or visiting blossomspregnancyregistry.com. The purpose of this registry is to monitor the health of you and your baby. Are breastfeeding or plan to breastfeed. It is not known if VUMERITY passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while using VUMERITY. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What should I avoid while taking VUMERITY? Do not drink alcohol at the time you take a VUMERITY dose. What are the possible side effects of VUMERITY? VUMERITY may cause serious side effects, including allergic reaction, such as welts, hives, swelling of the face, lips, mouth, or tongue, or difficulty breathing. Stop taking VUMERITY and get emergency medical help right away if you get any of these symptoms. PML, progressive multifocal leukoencephalopathy, a rare brain infection that usually leads to death or severe disability over a period of weeks or months. Tell your healthcare provider right away if you get any of these symptoms of PML. Weakness on one side of the body that gets worse. Clumsiness in your arms or legs. Vision problems. Changes in thinking and memory. Confusion. Personality changes. Herpes zoster infections, shingles, including central nervous system infections. Other serious infections. Decreases in your white blood cell count. Your healthcare provider should do a blood test to check your white blood cell count before you start treatment with VUMERITY and while you are on therapy. You should have blood tests after 6 months of treatment and every 6 to 12 months after that. Liver problems. Your healthcare provider should do blood tests to check your liver function before you start taking VUMERITY and during treatment if needed. Tell your healthcare provider right away if you get any of these symptoms of a liver problem during treatment. Severe tiredness, loss of appetite, pain on the right side of your stomach, have dark or brown tea-color urine, yellowing of your skin or the white part of your eyes, serious gastrointestinal problems including bleeding, ulcers, blockage, and tears, perforation of the stomach or intestines. Tell your healthcare provider right away if you have any of these symptoms during treatment. Stomach area pain that does not go away, bright red or black stools that look like tar, severe vomiting, severe diarrhea, coughing up blood or blood clots, vomiting blood or your vomit looks like coffee grounds. The most common side effects of VUMERITY include flushing, redness, itching, or rash, nausea, vomiting, diarrhea, stomach pain, or indigestion. Flushing and stomach problems are the most common reactions, especially at the start of therapy, and may decrease over time. Taking VUMERITY with food, avoid high-fat, high-calorie meal or snack, may help reduce flushing. Call your healthcare provider if you have any of these symptoms and they bother you or do not go away. Ask your healthcare provider if taking aspirin before taking VUMERITY may reduce flushing. These are not all the possible side effects of VUMERITY. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. For more information, go to dailymed.nlm.nih.gov. What is VUMERITY Diroximel Fumarate? VUMERITY is a prescription medicine used to treat people with relapsing forms of multiple sclerosis, MS, to include clinically isolated syndrome, relapsing-remitting disease, and active secondary progressive disease in adults. It is not known if VUMERITY is safe and effective in children. Please see full prescribing information, including patient information, via the link provided.